Well, good evening, everyone. Thank you all for being here. I know we still have a few folks coming in the back doors, but in honor of your time, we'd like to start right away. We really welcome you here to Lucille Packard Children's Hospital. I'm Nancy Sanchez. I manage community relations, and as part of Your Child's Health University, we welcome you to this very special presentation this evening in honor of National Eating Disorders Awareness Week. Eating disorders, time to talk about it. And we thank you all for coming to listen and talk about this very important topic with us. I'm very pleased to tell you about our distinguished speakers this evening. We have with us this evening Dr. Neville Golden. Dr. Golden is Chief of the Division of Adolescent Medicine at Lucille Packard Children's Hospital, and he's the Marin and Mary Elizabeth Kendrick Professor in Pediatrics at Stanford University School of Medicine. He's a board-certified pediatrician and adolescent medicine specialist with more than 25 years of clinical experience. He's nationally and internationally renowned for his research on the medical complications of eating disorders, with a focus on the management of amenorrhea and osteoporosis in anorexia nervosa. We'd like to begin with Dr. Neville Golden. Thanks, Dr. Golden.
Thank you and welcome to all of you. We are all here today for the same purpose. We want to fight eating disorders. In conjunction with the National Eating Disorders Association, we want to promote awareness of these conditions because we know that early intervention is associated with outcome that is much, much better. These are the images that our adult society is giving to our young people. That thinness is equated with beauty and success. And it's not surprising then to see that large numbers of our young people are dieting in order to lose weight. These are national data from across the country that show that approximately 60% of young girls in high school are dieting and about 30% of young boys are doing so. Now, clearly, not all of them are overweight. So what are eating disorders? They are conditions associated with severe distortions in thinking and behaviors that are related to eating, body weight, and shape, and they are associated with significant medical as well as psychiatric morbidity. There are three major groups, and I'm going to elucidate what they are. The first one is anorexia nervosa, the second one bulimia nervosa, and the third group, which is probably the largest group, is what we call EDNOS, eating disorders not otherwise specified. Anorexia nervosa is not a new condition. It's not a condition that we've noticed in the past 20 years, 30 years. It was first described in the 1600s by Richard Morton, a British physician, who called it a nervous consumption. Consumption was the wasting disease of the time. It is a condition characterized by voluntary self-starvation to the point of emaciation. And even in this emaciated state, these individuals consider themselves to be too fat. It occurs primarily in females, 90 to 95% of female, but we see an increasing prevalence in young males, 5 to 10%, and that ratio is much higher in the younger age group. In a young adolescent girl between the age of 15 and 19, somewhere between 1 and 100 or 1 and 200 girls meet criteria for anorexia nervosa. For bulimia, it's even higher. Anorexia usually has its onset in mid-adolescence, whereas bulimia tends to begin much later, in later adolescence. So the core features of anorexia nervosa, firstly, are weight loss or failure to make an expected weight gain during a period of growth. You do not have to lose weight if you're a young child who's growing in order to meet this first criterion. And this leads to a weight that's less than 85% of what's expected. There is an intense fear of gaining weight and a preoccupation with shape and weight. And there is a distortion in body image whereby the individual looks in the mirror and sees themselves or part of themselves as being fat. They can recognize that someone else is very thin, but they see themselves as being fat. And in the case of females, you need lack of menses for at least 3 months in order to make this diagnosis. There are different types, the restricting type and those who binge and purge. In contrast to anorexia nervosa, bulimia nervosa was only described in 1979, And the key feature of bulimia is the binging. That is, eating an amount of food that is excessive in a discrete amount of time, and there's a sense of loss of control during that binge. There are recurrent behaviors to compensate for the binge. We all know about the self-induced vomiting, but it can be use of diet pills, laxatives, diuretics, or it can be going to the gym and working out for 2 or 3 hours after a binge. In order to make the diagnosis of bulimia nervosa, you need to have a certain degree of chronicity, meaning that this occurs at least twice a week for a period of at least 3 months, because we know that these behaviors occur episodically on college campuses throughout the world. And here too, there's the purging type and the non-purging type. Now, there's this whole spectrum of eating disorders or disturbed eating, from normal dieting to a fully diagnosed eating disorder. No one will miss this, but the question is, where does your child or your friend's child or your friend appear on the slippery slope? These are data from our own unit over here. Rebecca Peebles and Jim Locke were involved in this, looking at the number of patients referred to us for eating disorders. And the vast majority of patients requiring treatment don't meet criteria for either anorexia nervosa or bulimia nervosa. And they are called the EDNOS. And it's a large category. This could include someone who lost 100 pounds but is normal weight, but thinks about food the whole time. Or someone who has lost weight but hasn't yet met that 85% cutoff. Or the 15-year-old girl who throws up every day to be thin. Or the 11-year-old who choked on a sausage on a hot dog and is afraid to eat. So there are a number of conditions that fall into this large category. Including in this as well is the female athlete triad, and that's a triad of 3 interrelated conditions. The first one being disordered eating. Some patients have eating disorders, but some do not. They may just be taking in insufficient calories for their requirements. They develop amenorrhea, meaning they lose their periods in females, and they are at risk for fractures. So if you have a relative or a friend or a daughter who is a runner and has lost her period, that's not simply a consequence of training, that's a red flag for a possible underlying eating disorder. I'm always blown away why a young person might develop an eating disorder, and it's complicated why any one person does that. It's multifactorial, but it's best to think of it in my way, for anorexia nervosa anyway, in thinking of predisposing factors, precipitating factors, and perpetuating factors. We now know that this is a biological disease, that there are genetic markers. It runs in families. Parents don't create the eating disorder. They're not responsible for it. In fact, we believe they're part of the solution. We know that if you have a family history of an eating disorder, you are more likely to develop one. It doesn't mean you will develop one, but you are more likely. We know that there are some neurotransmitter abnormalities that probably predated the onset of the eating disorder and may persist thereafter. We know that it's an issue of industrialized countries. You see it all over the world. It's not just an American issue. But the thin culture ideal does appear to play a role. Certainly in countries where there wasn't television and television has come in, the incidence of eating disorders has increased. But for anorexia, at least, there's a certain personality type, the obsessional, perfectionistic, high-striving young female or male who, despite his or her achievements, doesn't feel good enough about what they have achieved. Everything is okay in elementary school, and then what happens is adolescence comes in. And adolescence really is the onset of eating disorders for the vast majority, 90 to 95%. Sometimes there's a major life event. And what happens is, instead of dealing with sexuality, career choices, what am I going to do with my life, these individuals turn inwards and start to diet, may lose some weight, get positive reinforcement from people around them, and dieting starts a whole cycle of events, both biological and psychological, that are very difficult to control.